Welcome to today's Explainer. We're getting right into a really pressing situation today, the 2026 Ebola outbreak in Africa. But look, we're not just going to sit here and read the headlines to you. We're actually going to look at this event through a much broader ecological lens. We want to understand exactly how animal and environmental health are absolutely the keys to preventing the next global crisis. Okay, let's dive into this. What if the next major infectious disease threat isn't cooked up in a laboratory somewhere, but actually emerges right at the exact intersection where humans, animals, and the environment meet? When we see news of an Ebola outbreak, it's so easy to just view it as this sudden, terrifying, random panic. But we really need to reframe that. We've got to look at this outbreak not as some isolated crisis, but as a vital clue to a much, much larger mystery about how our world is actually interacting.
To understand the big picture here, we first need to lay out exactly what is happening right now on the ground. So, back in May 2026, the Democratic Republic of the Congo reported an outbreak of Ebola disease in Ituri province, specifically caused by the Bundibugyo virus. And just look at how fast this moves. By June, literally just weeks later, Uganda started reporting cases directly linked to transmission coming from the DRC. This rapid border crossing is exactly what prompted the World Health Organization to declare this a public health emergency of international concern. Fast forward to July 2026, and the WHO is still reporting transmission in these affected areas. Now, let me just reassure you right off the bat. This does not mean the entire world is going through an Ebola pandemic. No way. What this evidence actually shows us is that we have a very serious regional outbreak on our hands, which makes rapid detection, coordinated response, and regional preparedness absolutely crucial.
And that brings us to why this outbreak is just so immensely important to the whole field of veterinary public health. Ebola is what we call a zoonotic disease. That basically means it's an infection that can jump between animals and humans. In fact, get this, roughly 75% of all emerging infectious diseases in humans actually start in animals. So when you see that first human patient in a hospital bed, you are quite literally only seeing the tip of the iceberg. The real ecological origin of the infection heavily involves wildlife. Now, while we might not know the exact animal source for every single Ebola outbreak on day one, evidence from past outbreaks strongly points to wildlife, particularly fruit bats, as a really major natural reservoir for the transmission of the virus. Honestly, if we're only looking at the human patients, we are missing the entire upstream story. Let's move to and see how this builds. How does a zoonotic virus actually cross that species barrier in the first place? It's kind of like this fascinating multi-step detective story. Imagine a community living right up against a forest. People there might be hunting wildlife or maybe just handling wild animals. They might be going into caves where bats live, butchering animals for food, or even just coming into contact with environments that have been contaminated by infected animals. It's these everyday, daily interactions that create the exact opportunities a pathogen needs to cross those species barriers. But, and this is key, this spillover, as we call it, is definitely not inevitable. The pathogen really needs the perfect storm. It needs a susceptible host, a source, enough contact, the right transmission route, and the right environmental conditions to keep that transmission going. And you know what's heavily influencing those perfect environmental and social conditions? What we call the drivers of spillover. This right here is the absolute heart of the One Health dynamic. It's the idea that human health, animal health, and environmental health are all deeply, deeply connected. When we go in and alter the environment through things like deforestation, mining, or agricultural expansion, we're severely disrupting wildlife habitats. Throw in climate-related ecological changes, urbanization, and major population movements, and we are radically changing how humans and animals interact. It's these complex, interconnected changes that are literally pushing humans and wild animals into new, incredibly risky contact with one another. Now, what's really interesting about this slide is how tempting it is to look at all those environmental drivers and just make a massive, sweeping claim. Like, we can't just run around saying climate change causes Ebola, right? That would be a huge oversimplification. Instead, what's actually happening is that these environmental and social changes modify the ecological conditions. They change the patterns of human-animal interaction, which then potentially influence the opportunities for a pathogen to spill over. And that distinction matters immensely. Good public health communication has got to be based on solid evidence, not on drumming up fear with sensationalized clickbait headlines. This current outbreak also shines a massive spotlight on another huge driver, and that is human mobility. Because let's face it, communities don't exist in a vacuum. People travel for work, families are constantly crossing borders, health workers move between towns, and trade routes connect entire regions together. So, when you have mining and commercial activities bringing large groups of people into areas where they're interacting with wildlife, and then an infectious disease emerges, well, movement changes the whole game. Human mobility is the exact mechanism that transforms a tiny local outbreak into a major regional public health concern. And because of this reality, our disease surveillance just cannot stop at the hospital doors. No way. It has to extend way out into the communities, along those trade routes, and right up to the borders. And this brilliantly illustrates the paradigm shift we so desperately need right now. Look, when most people hear the word Ebola, they immediately picture the traditional response. Doctors, nurses, laboratories, hospitals, the whole shebang. But we have to realize that is a highly reactive downstream approach. It's literally just treating sick humans after the spillover has already happened. The One Health approach, on the other hand, shifts our focus to the proactive, upstream necessity of monitoring those ecological boundaries. We're talking about bringing in veterinarians, doing active wildlife monitoring, setting up biosecurity protocols, and really strengthening our animal health systems. Which brings us to the crucial, unsung detectives of this entire process, veterinarians. Honestly, veterinarians do so much more than just treat our household pets or farm animals. They are specifically trained to understand diseases across entire animal populations. They're out there monitoring wildlife and livestock health, investigating animal diseases right in the field, supporting outbreak investigations, and advising on biosecurity. They are working directly at that absolute critical interface between animals, humans, and the environment. Because at the end of the day, veterinary public health is ultimately about protecting human communities, not just treating animals. Okay, so based on all this data, there are 5 core, highly practical lessons we absolutely must apply if we want to change our trajectory against these infectious diseases. First, detect diseases early, so we can confirm them faster. Second, cross-sector surveillance. Human health data isn't enough on its own. We have to include animal and environmental data. Third, cross-border cooperation, making sure neighboring countries are fully prepped before cases ever show up. Fourth, we have to treat communities as true partners who get clear, transparent communication based on trust. And fifth, prevention is just significantly cheaper. Investing upfront in surveillance, trained personnel, and vaccines saves lives and prevents the absolute economic ruin of uncontrolled outbreaks. But hey, this isn't just about some high-level government policy. Disease prevention is a shared responsibility for all of us. If you live or work in an at-risk area, your everyday actions genuinely matter. Avoiding unnecessary contact with sick or dead wildlife, absolutely crucial. It's also vital to actually follow public health instructions during an outbreak and to use proper protection if handling suspected infected animals is completely unavoidable. And if you think you've been exposed, seeking immediate medical care is just as important as doing your part to stop the spread of unverified rumors. Seriously, every single person, from local farmers to laboratory scientists, has a critical role to play in keeping our communities safe. So the crucial point is, this dynamic isn't just isolated to the DRC or Uganda. This matters to literally every nation. Take Ethiopia, for example. Ethiopia recently went through its first recorded Marburg virus disease outbreak, which thankfully was officially declared over in January 2026 after a really highly coordinated response. But this proves a stark reality. Emerging infectious diseases are not just theoretical threats on a whiteboard, and they absolutely can and will appear in entirely new locations. When they do, countries need to already have strong surveillance, solid laboratory capacity, and immense public trust in place. Strengthening our One Health capacity isn't just some optional extra. It is a mandatory investment in our global health security. Which brings us to the biggest lesson of all today. The question we need to be asking isn't just, how do we stop Ebola once it starts? No, the much, much bigger question is, how do we detect the next zoonotic threat before it becomes a major human outbreak? And the answer? We have got to look upstream. Before a single patient ever walks through those hospital doors, we need to be asking the right questions. Was there an unusual disease event in the local animal populations recently? Did wildlife behavior suddenly change? Did people enter a new ecological area from mining or farming? Identifying those upstream triggers is quite literally the absolute foundation of modern outbreak preparedness. The story of a virus crossing from an ecological system into human populations doesn't have to end in a massive global crisis. Early detection, scientific collaboration, and genuine One Health surveillance can absolutely change our trajectory. But it leaves us with a pretty urgent thought to end on today. Are African countries, and honestly, the broader global health community as a whole, sufficiently prepared for the next major zoonotic disease outbreak? It's a wildly complex issue about our global health security, and it demands our immediate attention and investment. Thank you so much for joining me for this explainer. Stay informed, stay prepared, and keep exploring the incredible connections that shape our world.